Hello everybody, I'm Glen Macnow. Welcome to Ask the Doctor, presented by Cooper University Healthcare. I'm here today again and pleased to be with Dr. Brendan O'Connell, surgeon with the Cooper Metabolic and Bariatric Surgery Center. Some people have concerns in that where they work, where they're employed, this does require you to take some time off. What is the recovery time for that, and typically how do people deal with that in terms of their work?
So, in almost all cases, the operation is done laparoscopically. So what that means is instead of having to make a big incision down the middle of the abdomen, we make 5 or 6 small incisions, and we're able to put our instruments in and do the surgery that way. Provided that we can do that, the recovery time is usually about 3-4 weeks from the time of surgery. That doesn't mean you're laid up in bed for 4 weeks. It just means that you're slowly recovering, and in the beginning it's very hard to drink large quantities of fluid at once. And so we want to make sure that you don't go back to work too soon and become dehydrated. You want to make sure you can constantly be drinking throughout the day so that you keep your hydration level up. Now, 3-4 weeks, 4 weeks is what I typically tell people. There are certainly people who need to go back to work a little bit sooner than that, and so what I do is I evaluate that on a case-by-case basis. If somebody is able to do some work from home, or if they work in an office and they're able to have some water or something to drink with them throughout the day, and they're doing well afterwards, then we may clear them to go back a little sooner than that. If somebody is a construction worker or needs to do very physical type of labor, I may keep them out until 6 weeks or 8 weeks. It just depends on how their recovery is. But in general, that's about the average time.
No restrictions for driving or anything like that?
The restrictions for driving are about 2 weeks. I need to make sure that patients are no longer taking any pain medicine.
That's a good idea for all of us.
But I tell them once they're off pain medicine, if they feel comfortable and they feel like they'll be able to safely operate the car, then I clear them to drive. I tell them to start with some small drives around to make sure that they're good.
Okay. How does, this is a good question, and it's probably the most basic one, how do I know if I am a candidate for bariatric weight loss surgery?
So again, we want you to be somebody who has tried to lose weight through diet and exercise and not been able to achieve that. After that, if you meet those criteria that I mentioned earlier, as in your body mass index is 40 or above, or it's 35 and above, and you have those medical issues, then you are most likely a candidate. The important things we want to establish are that you've thought about this and you are prepared to work with our dietitians on changing your diet, because while many people may meet the criteria to have weight loss surgery, not everybody has the type of outcome that they want, and that is because while the surgery may work and they may get through the operation without any major problems, we also want you to be committed to the dietary changes, and those are the people who are going to do best with it.
How soon after the surgery does the weight come off?
Well, it depends on which operation you have. Some of them work a little bit faster than others. For instance, with the band surgery, I tell people that they may lose around 4 to 5 pounds a month. With the gastric bypass, those patients may lose about 20 pounds a month, and with the sleeve operation, it may be somewhere between 10 and 15 pounds a month.
Okay. You talked about body mass index. It's got to be over 40. Most people do not know their own body mass index, obviously. So somebody asks, is there a certain weight I have to be over to qualify for the surgery?
So typically what we're talking about is somebody who is 100 pounds or more overweight. That's about the rule of thumb.
All righty. Are there any side effects from bariatric surgery? Is it common to have any worrisome side effects?
Well, that's a very good question. These operations are in general very safe, but they of course are operations and they're not without risk. The side effects have to do with which operation you're having. So with some of the operations you may be at risk for getting an ulcer in your stomach. This is particularly the case if you are smoking,
Mm-hmm.
or if you're taking medications like NSAID medications, those are Advil, Motrin, those types of medications put you at risk for an ulcer. Certain operations will also put you more at risk for obstructions of the intestine. And finally, some of the operations work by limiting the way your body absorbs things. So while that is a good thing when it comes to calories, it's not necessarily a good thing when it comes to certain vitamins.
Mm-hmm.
So there are certain vitamins that we want you to take, particularly if you've had a gastric bypass, and those are going to be a multivitamin with iron, vitamin B12, a B complex vitamin, and calcium, because you will be a little bit higher risk for getting vitamin deficiencies
Right.
after that, and so it's important to take those vitamins.
All right, so that leads into the next question. I think the answer is probably obvious, but I think they probably want to hear it from you, Dr. O'Connell. What happens afterwards in terms of regular follow-up with both a person's personal physician and with you or whoever's doing the surgery over at Cooper?
Okay. So it's important to have a regular primary care doctor. So for anybody who comes to see me, if they don't have that, we're going to help them to get set up with somebody, just because that makes good sense. The follow-up with our practice is going to be for the rest of your life. We have found over the years that the best results with weight loss surgery come where you have people following up with your practice forever. Now, we see people more frequently in the beginning stages. We'll see them about 6 times a year for the first year after surgery, and then about 3 times a year the second year, and after that we'll see you once a year so that we can make sure you're keeping your weight off, and we need to check some blood work to make sure your vitamin levels are where they need to be.
All right, so here's the big one. I'm sure you get all the time. How hard is it to keep the weight off once you get the surgery? We talked a little bit about that before, but I'm sure there are many people who feel, okay, I'm going to do this, I'm going to commit to this, but I don't know what it's going to be in 2 years, in 5 years.
Yeah, that's a hard question. You see a lot of variety in terms of how much people struggle. But it's the rare person who doesn't have any struggle. I mean, people tend to have relapses in their dietary behaviors over time. And so I think it's hard to have weight loss surgery. I mean, I think you need to make a commitment in your mind. You need to have some courage to go through an operation that is elective, aimed at making you a healthier person down the road. And you need to have some stick-to-itiveness. Now, our practice is designed to really give people the support that they need to get through those times. So that's why we schedule regular follow-up with people so that we can keep on top of them. And if we notice that their weight is starting to creep up, and we're going to try and look into that and see if we can figure out what's going on.
I'm sure support of family and friends and coworkers is all very, very helpful as well.
That is very helpful, Glenn. I'm glad you mentioned that. And it's not unusual for us to have patients where multiple family members are patients. And so,
Is that right?
yeah.
Same time, or you?
No, we would stagger it so that people can.
Somebody's got to take care of somebody, right?
Right. The husband and wife deal, we always make them
Who
go at
always goes
different
first?
times.
The wife go first? Who goes first?
It depends. It depends on whoever wants to go first.
Okay.
It's often, sadly, the men are more afraid, so they defer.
That doesn't
their
surprise
wives.
me in the slightest. Of course not. We're all a bunch. We don't go through childbirth. We don't know
That's right.
anything.
That's right.
We're,
That's right.
we're not as tough. All right. So, doctor, finally, if somebody's thinking about it, and as you say, they're 100 pounds or more overweight, they've been trying this diet, their exercise, they're just whatever, they're having a tough time. What's the next step? What should they do?
So, if you're thinking about having surgery, then you call and make an appointment with a bariatric surgeon. I would recommend looking for a place that is a center of excellence, which means that they have the other various support programs in place. And you make an appointment with a surgeon, and they are going to discuss with you your own medical history try to help you come up with which operation might be the most appropriate one for you, and then outline the testing that we discussed to get you started on your way.
All right. Dr. Brendan O'Connell, terrific. Thank you so much for your time, for answering all questions, and thank you to everybody who sends in the questions. It's really helpful.
They were
and
good.
We really appreciate it. Yeah, that was good stuff, and we really do appreciate it. If you would like more information on the Cooper Bariatric Program, please go to cbsphilly.com/CooperDocs, cbsphilly.com/CooperDocs. Until next time.
Thank you, Glenn.
Thank you very much.